So as we move from immune mechanism into prevention, we'll keep in mind that vaccines are one of the clearest practical uses of immunology because they are training the adaptive system without requiring the patient to experience the full burden of the disease. So let's take a look at a few slides pertaining to vaccine, herd immunity, and practical immunization picture. Now, of course, vaccines, they are our attempt to mimic infection, to be close enough to generate adaptive immunity without forcing the patient to suffer the full disease process. So the goal here is to help produce memory, especially antibody responses and helper T cell support, so that future exposures can be handled more quickly and more safely. So one important point is that vaccine-induced immunity can wane over time. So when you go to the doctor, this is often why there may be booster shots that are recommended at certain intervals. So you've had a vaccine as a child, but then as an adult, we need to get a re-up on that vaccine so that the immunity remains relevant and that we don't see a decline in some of that immune function should that disease arise within the body. Now, sometimes we assume a vaccine means permanent protection forever, but that's not always true because natural infection can sometimes produce long-lasting immunity, but that comes with obvious risks and it's usually strain specific. So what we'll keep in mind is that vaccines often include more than one core antigen, but there might be some other elements that help to strengthen the immune response. In some infections, especially intracellular pathogens like tuberculosis, generating effective immunity is more difficult. So vaccines can be a powerful tool so that you don't have to get tuberculosis to be protected from tuberculosis. Now, vaccines are powerful, but they're not all equal and simple to design or to maintain. So when we look at vaccine immunity, of course, you may need a booster shot, as I mentioned. Let's say MMR, right? That might be given, measles, mumps, and rubella, that might be given twice during childhood. However, a college-age person may develop an infection because the effectiveness of the vaccine wears off. Mumps can also cause males to become sterile. Chickenpox can lead to pneumonia. So again, why don't we want to expose ourselves to a variety of conditions? Because sometimes the side effects can be highly problematic. So generally what we'll consider is the use of a vaccine is to avoid the much greater or much more challenging actual disease. To prevent that disease from taking hold, vaccines are provided to boost immune function so that when the body encounters them, we already have the memory cells ready to go, ready to fight the infection. This table shows a lot of great data. We're looking at immunization successes at the population level, and this table is less about mechanism and it's more about perspective. Before widespread vaccination, many infectious diseases caused enormous morbidity and mortality. And when you look at the percentage reductions here, the public health impact becomes hard to ignore. Rubella and diphtheria dropping 99 to 100% in reported cases following the introduction of the vaccine. This matters because immunology can sometimes feel abstract in the way that we're looking at the cells and the cytokines and that overall function. But if we keep in mind the ideas to decrease the pathogen taking hold, then looking at the population level, when a vaccine uptake is strong and we identify disease burden falls dramatically, there might be some utility to increasing the availability of these vaccines. And it helps to understand why missed doses or missed boosters might matter. So if an individual skips a follow-up dose or delays them and cannot receive certain vaccines because of an allergy or contraindications where they're not able to receive the vaccine. Over time, we might have population with reduced coverage, and this can allow preventable diseases to start to reappear. So this figure is really a reminder that prevention is not passive. It depends on ongoing participation, and over time, status of vaccines might begin to differ depending on whether a community is taking or participating in vaccination programs. So before we had vaccines, we had lots and lots of problems, and the percent decrease of some of these pretty pretty troubling diseases is pretty evident that with the vaccine present, we are able to reduce some of these increases in conditions. Measles, mumps, rubella, for instance, a pretty large decline when we follow a proper vaccination routine. And we can approach this slide with kind of a similar nature of a more of a practical reference rather than this mechanism heavy approach. Here we're just looking at the adult immunization schedule that helps clinicians to recognize what is recommended at different ages and under different conditions. So even if we don't memorize line by line, I think it's important that we're comfortable reading the schedule and identifying major patterns. At what point in time might we need to have a dose of a vaccine, or for instance, a follow-up dose? How long is that dose viable? For instance, Tdap protects against tetanus, diphtheria, and pertussis, and we may need to get a booster every 10 years. So it remains relevant beyond childhood to continue a vaccination program. Varicella vaccination protects against chickenpox, which many people underestimate, even though it can lead to significant complications such as pneumonia. So this is why it may be preferable to get a vaccine in some conditions where a participant can avoid the condition altogether. Other participants, they may be allergic to a vaccine or unable to get a vaccine for certain other complications, and they may have to navigate the potential that they might end up with one of these diseases. So as we close this segment, I want us to leave with 2 points. First, vaccines are an application of the adaptive immune memory. And second, the immunization schedules are practical tools that support real-world prevention. So knowing how to read these is part of what's clinically useful, even if you're not the person administering the vaccine, recognizing that we need to keep on this vaccination schedule even into adulthood. This didn't just end as we grew out of childhood. And our final takeaway from this segment with immunology is not just about understanding disease, but also about preventing disease. And vaccines harness adaptive memory, herd immunity, protects populations, and immunization schedules can turn immune science into everyday clinical practice. And remember to keep in mind a booster schedule may be important. The varicella-zoster vaccine, also known as the chickenpox vaccine, protects against chickenpox, a common, very contagious childhood viral illness. The vaccine is given as a shot, and when children are typically about 12 to 15 months old, but then again, a booster shot at about 4 to 6 years of age. So one dose is going to prevent about 95% of moderate disease, 100% of severe disease, and 2 doses may be more effective than 1. So keeping in mind some of these schedules, how to identify whether or not repeat vaccinations may be necessary.